Sarve Bhavantu Sukhina. Welcome to Ask Dr. Gupta. The government hospitals are crowded and the private hospitals are expensive. As this press cutting suggests, the government hospitals sometimes might not have even essential drugs, and this happens even in metro cities. In this environment of mistrust, can we ensure the right treatment for our family? People actually doubt if private hospitals are offering the right treatment or they are focused only on money. We all know, and it is in data now, that more deliveries happen by cesarean section in private hospitals as compared to government hospitals. And the doctors, the obstetricians have said this on camera that sometimes the delivery is expected to happen at midnight, or sometimes there are 2-3 deliveries happening at the same time, or many times even they have to go to a party and the delivery might happen in their absence. In this situation, they resort to cesarean section. This has been said on camera in a TV program long back. I personally get a big number of patients from Noida, Greater Noida, Faridabad, Gurugram and even Delhi who are sick of 5-star hospitals. Their grievance is that their treatments are not explained to them and unnecessary tests and procedures are probably done only to make money. This is their feeling. This may be right, this may be wrong, but this is what the patients are made to feel. In today's discussion, to understand what is the right way, we will first have to understand what are the problems in government hospitals and what are the problems of private hospitals. We shall highlight some problems that you might not have even imagined, and they are jaw-dropping, especially in case of private hospitals. And we will also discuss the way forward, how to circumvent this and how to ensure best treatment. We had discussed the reasons for dissatisfaction after treatment in our dedicated video, and the link to that video is in comment and in description. First, we shall discuss what are the pitfalls in treatment in private and government hospitals. The private hospitals generally have good ambience, they are relatively less congested, and the staff behavior problems are also relatively less. In addition to all this, the treatment decisions are faster and the access to senior doctors is relatively fast and is easy. However, the questions about the ethics in treatment are sometimes real. I shall give some examples of what I have myself seen happening in private hospitals. This story of injury being repaired with Fevikwik was widely reported and prominently reported in newspapers. The hospital vehemently refuted this, but it shows the level of mistrust that exists among healthcare providers and the public. I shall give one example from my city where a patient walked into a big cancer hospital of our city. She was diagnosed with a gallbladder mass and she was advised to take chemotherapy. There was no FNAC or biopsy done, which is mandatory before starting chemotherapy treatment, and the treatment decision was taken solely on the basis of imaging. The lady came to me for a second opinion, and what I could find that the lesion was actually operable. There was possibility of surgery. Those who have watched our video on gallbladder cancer know it very well that surgery is the only option that can cure the gallbladder cancer. Every treatment other than surgery is only to give the patient some valuable time. So the curative treatment was actually denied and the patient was put into palliative treatment. The FNAC or biopsy is avoided in cancer gallbladder in surgical cases, but it is mandatory before chemotherapy. The lady was operated upon, and when the final report came, it was shocking. It showed that the lady did not have cancer at all. Actually, it was a rare situation where the mass that was looking similar to cancer on imaging was formed by tuberculosis or TB of the gallbladder. So now just imagine, if chemotherapy was given to this lady in this infectious condition, then the tuberculosis would have probably exploded, and the decision to give chemotherapy and not offering surgery was taken by a radiation oncologist without even consulting his surgical colleague. Another similar case I have from a big corporate hospital of Noida, where a case of stage 4 cancer again of gallbladder was taken up for surgery, even when the investigations before surgery suggested that the disease is disseminated and surgery is not going to benefit this patient. Expectedly, nothing could be done during the surgery and the abdomen was just closed back and the patient was sent back, sadly, for financial benefits. Similar case happened with one patient in our city also, where a patient with a cancer of gallbladder that had spread to nodes in her neck was taken up for surgery and sent back after just opening and closing her abdomen by a person who was not a cancer specialist, who was a general surgeon. The same surgeon read somewhere that breast can be conserved in cancer of breast. So he decided to try his hand in breast conservation and operated upon a lady and gave this kind of result. And with due apologies and due respect, I will say that had the breast been removed completely, then the flat chest would have looked better than this remnant. I had one more patient again from a corporate hospital in Delhi who was offered very costly targeted therapy for the cancerous tumor, even when the target was clearly negative in the studies. That means the drug was meant to address a target that actually did not exist. This situation is particularly bad when a patient has a fat health insurance policy. We have discussed this in detail in our previous video. The picture at government hospitals is also problematic. We all know what kind of waiting list the specialized hospitals like All India Institute and Tata Memorial Hospital have. Even in OPDs, the patients sometimes are seen sleeping on footpath for their turn to come the next day so that they can meet doctors. And many a times the patients might not even survive for their number of surgery to come after that long waiting. The behavior of staff, especially lower staff, is always complained against. Unfortunate situation of dogs in labor rooms and in wards is also not unheard of. And corridors of hospital about their cleanliness and the condition of bed seats is better not discussed. One problem is in institutes, which is the wide variation in the capabilities of junior doctors. Many a times the young doctors are as good as their professors in taking treatment decisions, but this is not always true. I will highlight this with this one example where this CA 125 test was ordered by a junior resident at a big government hospital of Delhi. The barcode number is hidden to ensure patient's privacy. This was a cancer patient, cancer from unknown primary. As I have highlighted, this is marker for ovaries. And this was ordered in a male patient in whose body ovaries do not exist. Obviously, the resident doctor who was ordering it was clueless about the investigations to be ordered in case of cancer from unknown site. People go to government hospitals with a hope that the treatment is going to be free. However, these recent press cuttings from national newspapers, they show that sometimes the big hospitals, even in metro cities, run out of essentials like gloves. The respiratory medicines were reported to be out of stock in some Delhi hospitals at the time when pollution was at its peak and the respiratory problems were highest. Government hospitals cannot be dragged to consumer court for negligence. Probably this might be leading to some laxity and sometimes even carelessness. It is highlighted by this instance where a job to fill up the drug in nebulizer was given to a ward boy. Actually, this is job of a sister, but the ward boy was asked to do this, and he filled the nebulizer with the spirit instead of distilled water. Another case where the tape that was put over the cannula was being cut, and the sister ended up cutting the thumb of the infant also. This is scary, but these are not hearsay. These are newspaper cuttings. At the same time, these big teaching hospitals, when I say government institutes, I do not mean the district hospitals and the medical colleges, small medical colleges that today exist in almost every district. I mean specialized hospitals like we have Tata Memorial Hospital for Cancer, or like we have the Government Children's Hospital in Noida. This kind of hospitals which are dedicated specialized government hospitals. And in these hospitals, even if a junior doctor orders the test of cancer ovary for a man or test of cancer prostate for a woman, the final treatment decision is taken by professor, and these decisions are generally scientifically sound, unless he is a general surgeon ordering treatment in a specialized case in a general hospital. The genuineness of treatment is very much ensured at specialized centers, but there can be waiting for months. We have always said that right treatment at right time. If we are waiting for months, that means the treatment might be right, but by delaying the treatment, we are actually limiting the benefit. So is there a way out where right treatment can be given at right time? The answer is probably yes. In my experience of having worked at the most respected cancer hospital in the country for many years and later on in private practice, I feel that the only way out is to remain focused on the doctor who is treating you. Whenever one visits any hospital, he should ideally be aware of his illness and the doctor he has to meet. In short, some homework is to be done before going to a hospital. Generally, this one precaution ensures that you get right treatment whether you are going to private hospital or to government hospital. Still, if someone has doubts, then one can go to any of the specialized institutes and get opinion from a senior faculty. Many government institutes, they have private OPDs where the meeting with a senior doctor can be arranged relatively faster at payment of some consultation fee. The actual treatment can later on be taken at a hospital near you, at a private hospital near you. This can be one method where you can cross-check the opinion and also bypass the rush at the institutes. Remember, do not waste your time in taking too many opinions. One or two genuine opinions should be enough to make up your mind. At the end of the day, the only way to ensure right treatment is to ensure that you are being treated by the right doctor, by a specialist, whether it is a government hospital or a private hospital. Ensure you go to the concerned specialist only. Do not remain focused on the hospital. The examples that I gave of corporate hospitals ordering wrong treatment were those patients who had gone to the hospitals without any idea of which doctor they should be meeting. So please be focused on doctor's credentials, not on the hospital's building. The consultation at institutes, government institutes, can be for cross-checking. Having done all this, please have faith in the person you have shortlisted for your treatment. With all this, I wish all of you a very speedy recovery and everyone a very healthy life. Thank you. Namaskar.